Hiccups, you got to be kidding me. Hiccups are common, typically transient, occurs in everyone. It's involuntary, intermittent, and spasmodic contractions of the diaphragm and intercostal muscles that are believed to be the cause of these hiccups. Prolonged hiccups can affect quality of life by interrupting drinking, eating, sleeping, ultimately leading to malnutrition, weight loss, and dehydration. Hiccups lasting longer than 48 hours are rare and may be a sign of a serious disease. And so we demonstrate that benign initial presentation, such as an everyday occurrence, such as a hiccup, can be a small glimpse into a more serious disease process, such as acute kidney failure. Here we present a 62-year-old male with past medical history of coronary artery disease, status post-stent placement, hypertension, hyperlipidemia, asthma, and previous nephrolithiasis that presented to the emergency room with an one-day onset of violent hiccups. He had an episode of emesis that provided minimal relief, but he was hiccuping throughout the night and unable to sleep, so that's why he presented to the emergency room. He had admitted to using chronic NSAIDs, 2 to 4 tablets of ibuprofen, for the past several years due to chronic back pain. At the time, he denied any herbal supplements, no changes with his urination. He was not a smoker, didn't drink, denied any illicit drug use. No family history of any renal disease or any recent surgeries at all. Upon admission in the emergency room, vitals and physical exam were unremarkable, with no suprapubic or costovertebral tenderness. Quickly looking at Table 1 at the initial urine analysis, it was mostly unremarkable. Specific gravity noted to be 1.004, no signs of an infection. There was no eosinophils or casts noted either on the urine analysis. In terms of the etiologies of prolonged hiccups, you think about structural or infectious or inflammatory disorders that can affect the central nervous system, or more specifically the vagus or phrenic nerves that are believed to be the reasons for these prolonged hiccups. So the patient was given lorazepam and prochlorperazine in the emergency room, as well as started on IV fluids, baclofen, and omeprazole, which are believed medications that are given for patients with hiccups. However, the patient's hiccups persisted longer than 48 hours after admission. Physical maneuvers were performed, breath holding, Valsalva maneuvers, knee to chest, with no relief at all. Looking at Table 3, his initial creatinine was 2.7, his baseline was around 1, and then it peaked about 5 days after admission at 10 with a creatinine of 10, contributing to the toxic metabolism that was going on for the patient. No obstruction was seen on imaging. On the renal ultrasound on admission, there was no signs of renal calculus or hydronephrosis. There was no active process in the chest x-ray. CT abdomen pelvis, no evidence of nephrolithiasis or any obstructing calculus in the ureter as well. And they also did a CT thorax where there was no pulmonary nodule seen at all. And so nephrology was consulted. They did a workup for intrinsic disease. Looking at Table 4, mostly everything was negative. ANA was negative. Antibodies were negative. Immunoglobulins were normal. Hepatitis panel was negative. HIV was negative as well. And so with that, kidney biopsy was performed to try to find the reason for his elevation in creatinine. And so looking at A, with the arrows, we can see calcium oxalate crystals deposits in the tubular lumen, as well as in here, and B, acute tubular necrosis. And in C, we can see here calcium oxalate crystals with polarized light. And then D, we can see some mild diabetic glomerular sclerosis and tubular changes. And so with oxalate crystals, there are certain indications for the cause of it, and one being high doses of vitamin C. Found out from the patient that he drank and ate a lot of noni fruit and juice because he had a tree in his backyard. It's believed that the noni fruit has high contents of oxalic acid and vitamin C that combines with calcium to form oxalate. And so the patient ultimately was discharged home to continue dialysis, and diet was discussed with the patients. Hiccups were resolved after starting dialysis. And so a learning point from this presentation was a benign presentation as hiccups can be an early warning sign of a life-threatening disease, such as acute renal failure. And this is a valuable presentation of hiccups and renal disease, reference for treatment-resistant hiccups induced by supplements. Thank you for your time. Let me know if you have any questions.